Yes, in fact, we do know what causes this disease. It's a new virus that came about in China probably back in December 2019. It's known as the SARS-CoV-2, which is the new virus that was just discovered that is causing the coronavirus disease, COVID. So an incubation period is the time from exposure to a virus until the time that you develop the disease. In this illness, it ranges typically from 4 to 7 days, but it can be shorter or even up to 14 days. On top of the incubation period where you don't show symptoms, some people seem to be able to shed this virus without ever having symptoms. So yes, it is possible. It presents like the flu. It's a flu-like illness with fever, cough, sore throat, and just generally feeling cruddy. One thing that is absolutely the same, the way you should deal with having the flu and deal with having the coronavirus, is protect everybody else around you by not going out. Don't go to work, don't go to school, and if you feel like you need medical care, call the advice line or call your clinic to get further directions. We don't know if anybody is more at risk of contracting the illness, and I don't think so. But what is very clear is that some individuals are at higher risk for having severe disease and having potentially more serious consequences. These include older people, particularly above 80 years of age, and anybody with an underlying medical condition that puts them at risk, like lung disease. We treat this clinically, and we would treat based on the individual's symptoms. So I wouldn't treat an 80-year-old with no symptoms any differently than I would treat a 20-year-old with no symptoms. Face masks are helpful in one circumstance, and that's they are helpful to prevent a sick individual from spreading it to healthy individuals. That's because it catches the respiratory droplets that they may be excreting when they cough or when they sneeze or even just breathing. For a healthy person, a surgical mask does not really prevent the illness. It seems to be fatal only in individuals who have pre-existing medical conditions thus far. And the really good news is that it doesn't seem to have caused any deaths in children. That said, while the mortality rate figure keeps changing somewhat, it seems to be right around the 2 to 2.5% range for the entire population. Again, much higher for those older folks and for people with pre-existing conditions. They should be more concerned about passing it on to somebody at greater risk. So many of us are in fact going to contract the coronavirus. We expect this. I expect that I will. I'm young, sort of. I'm healthy. I'm not particularly worried, but I would be really worried about giving it to my mother or my father or other older people. There's some new information coming out and it's a bit conflicting. I really don't want to speculate whether or not it can be passed from human to animals, but what I can say is that the CDC does recommend that if you're sick with this, that you limit your interactions with your pets, and if you have to interact with them, put a mask on before you do so. Absolutely not. There is no indication that individuals can contract this illness from parcels or letters. Yes, we have. We've seen outbreaks going on right now in Italy. It's in almost every European country where we have good data. Typically right now in smaller numbers, but by the time you're watching this interview, it may in fact be greater numbers. It's a moving target at this point. The virus is spread by respiratory droplets, we believe. That means that you need to be typically within about 6 feet of somebody to be at risk for contracting that. Or you can pick it up from your hands touching a contaminated surface like a doorknob or a table and then touching your face. So make sure you wash your hands frequently to prevent that exposure from occurring. The U.S. Centers for Disease Control recommends social distancing as the best way to prevent illness right now, since we have no vaccine or other means to prevent it. What this means is trying to minimize your contact with sick people, particularly getting within that 6 feet risk zone. So people may at this point in time want to consider minimizing their attendance at large gatherings or other events where they may come into contact with sick people. I would recommend for civilian travelers in particular that they look at the US CDC website. It lists the travel advisories for all the countries, and since that changes all the time, at this point I'm simply advising people to look before they travel. I will not say no, because it is always a good idea to wash fruits and vegetables and cook all foods thoroughly. In general, it seems that coronaviruses thrive in the colder weather, but again, this virus, its behavior is still relatively unknown to us. So we'll have to keep an eye and see what happens as the temperatures do warm up here in Europe. So get plenty of sleep, eat right, and again, avoid close contact to sick people. There are currently several vaccines in the works, but we don't expect any of them to be available in the near future. We are learning more and more about this virus and potential treatments every day. Research is certainly ongoing. However, at this time, there is no known treatment for this disease. So at home for self-care, the most important thing is that they avoid contact with other individuals as much as possible. If they're living with other people, they should follow the advice on the US CDC website that gives really the best up-to-date information on how to protect other people. As far as themselves, they should remain hydrated, so drink plenty of fluids, and also make sure they get as much rest as they're able to. If anybody develops shortness of breath, if they become dizzy, or they just feel concerned about how they are progressing, they should call the advice line, call their clinic, or if they're very severe, call the emergency services. So long as they're not severely ill, self-care can be accomplished quite safely. The key thing is that they not infect other people. So if they're interacting with people in their homes, they should wear a mask. And if they go outside of their home to go to clinic appointments or other necessary travel, which they should limit, they should wear a mask in those cases. As far as for themselves, the main thing they need to avoid is dehydration. So plenty of fluids, eat whatever food they feel comfortable with, and get as much rest as possible. Health facilities and garrisons have been preparing for outbreaks like this one for years. They have plans, these plans have been exercised, and we're fully prepared to take care of patients in a safe manner. At this time, I would go back to the performance triad. Eat right, get plenty of rest, and as you're able to, unless you're very sick, exercise. No, we have not seen any cases yet in our healthcare providers, but around the world, yes, it is known that healthcare providers are at risk for acquiring this disease. However, we have proper protective measures in place. We have the protective equipment and we have the training. We can provide care that is safe to our patients and to ourselves. You are at no risk if you deliver some nice goodies outside their door. You can even talk to them as long as you maintain that distance and they are masked. Certainly give them a call, check on them. We want to make sure our battle buddies are okay, no matter if they're in quarantine or out and about. This is a situation that is evolving so fast, I really don't want to give specific recommendations about specific countries. The best information available for our civilian travelers is the US CDC website that lists travel advisories for every country. And for active duty and civilian workforce and our contractors, they should be getting information from their units because they will have the most current, up-to-date information available. The recommendations for that vary from location to location. We want to remain in lockstep with our community outside the gate. So I would recommend individuals, if they have questions about that, they call the advice line or their local clinic to get the best information about the area they are in. So yes, there are certainly some supplies that people should have on hand in case they have to quarantine. A great list is available on the US CDC website that lists all of their current recommendations. And also other government agencies have lists of supplies that it's important to keep on hand at all times in case of any emergency. We are monitoring it every day, but we do in fact expect it to get worse before it gets better. This is a disease, frankly, that has a fairly high infection rate, but is fairly mild. So we do expect lots more cases. We're ready for it, and we're going to take care of people as they need to be taken care of. Coronaviruses typically jump from animals to humans. Lots of viruses do this. Most new infections, in fact, do come from animals. We do not yet know exactly the route this one followed, and we're continuing to study that. The one thing I really want to get across is that we have a healthcare system that is prepared, that will deliver quality, safe healthcare to our beneficiaries, and it will do this both during this outbreak and beyond. There is a test that is available through the United States Centers for Disease Control, and we believe that that test will be available to us locally in the coming days. It again, like everything else, is a moving target. Host nations also are able to test for this virus, but criteria to be tested varies from location to location. Some places will only test people who are very sick. Some places will test individuals who just have a travel history to a high-risk area. Best advice, contact the advice line or your clinic, and remember, we are not at this point going to be testing people if they want to know if they have the virus. We are only going to test them if they are sick, and we need to make the determination if it is COVID that is causing their illness. Quarantine is when we ask people who have been potentially exposed to a disease but don't have symptoms, we ask them to stay away and create distance between themselves and others. Isolation is when somebody develops symptoms and we ask them to stay away and keep social distance from others. The garrisons are working with medical authorities to identify areas where we can place people safely and provide them with the care that they need, not only medical care, but also food and sanitary facilities. There is a difference, though, between isolation and quarantine. Quarantine is what we do, or we ask, individuals who've been exposed to a disease or potentially exposed, but do not yet have symptoms. Isolation is what we ask individuals who have symptoms to do. They isolate, they keep themselves away from others so that they don't spread the illness.